Today we will discuss atelectasis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Atelectasis is a condition where part or all of the lung collapses or does not inflate properly. This can lead to reduced oxygen levels in the body. Signs you might have atelectasis: shortness of breath, feeling like you can't catch your breath. Cough, persistent cough, sometimes with mucus or phlegm. Chest pain, discomfort or pain in the chest area. Rapid breathing, breathing faster than normal. Cyanosis, a bluish color in the lips or fingers, indicating low oxygen. When to see a doctor. If you experience any of these symptoms, especially after surgery or if you have a respiratory condition, it is important to seek medical advice. A doctor can perform tests such as a chest x-ray to detect atelectasis. If someone has this condition, here are some simple steps to help. Encourage deep breathing. Take deep breaths to help the lungs inflate. Gently cough. Coughing can clear mucus from the lungs. Move around. Encourage walking or changing positions to help the lungs expand. Use an incentive spirometer. If available, this device helps with deep breathing. Stay hydrated. Drinking plenty of fluids can thin mucus, making it easier to cough up. When to seek help. If symptoms worsen or do not improve, contact a doctor for further evaluation and treatment. In the hospital, here's what doctors might do to treat someone with atelectasis. Breathing treatments. They may use machines like nebulizers to help open the airways. Nebulizers are also used for asthma. Just a fun fact over here. Oxygen therapy. Providing extra oxygen to help with breathing. Chest physiotherapy. Techniques to clear mucus from the lungs, like tapping on the chest. Incentive spirometry. Encouraging the patient to use a device that helps with deep breathing. Medication. Giving medications to reduce inflammation or treat infections if needed. Positioning, helping the patient sit up or lie in a position that makes breathing easier. Follow-up care. They will monitor the patient closely and may perform imaging tests to check if the lungs are improving. Common medications include bronchodilators such as albuterol, which will help open up the airways, or ipratropium, which also aids in relaxing the airway muscles. Steroids, these will help in reducing inflammation in the lungs, and the example given here is prednisone. Mucolytics such as acetylcysteine, this thins mucus, making it easier to cough out. Antibiotics if there is an infection, such as azithromycin, which treats bacterial infections, or ciprofloxacin, which is another option for bacterial infections. These are two different classes of antibiotics. The ciprofloxacin is part of the cephalosporin class. Please consult a healthcare professional for specific recommendations and dosages. People at higher risk of developing atelectasis include smokers. Those who smoke can have damaged lungs, making it harder to breathe. Post-surgery patients, especially after chest or abdominal surgery, lying down can still lead to lung collapse. people with lung conditions, such as asthma, COPD, or pneumonia, older adults. They may have weaker lungs and less ability to take deep breaths. Obese individuals. This extra weight can put pressure on the lungs, making it harder to expand. Bedridden patients. Staying in one position for too long can lead to lung issues. These factors make it more likely for someone to develop atelectasis. Now you need to watch my video on heart attacks or have a look at strokes.